Thanks for listening today. I want to be transparent with you. Besides hosting this podcast, I also work for Everly Health, our sponsor for today's episode. However, all views and opinions expressed on the podcast are my own or those of my guests, not those of Everly Health.
Welcome back to DigitalMD, the podcast where we talk to leaders in the digital health ecosystem about innovation, decision-making, and how they think. I'm your host, Dr. Liz Kuo, and today I'm thrilled to have Dr. Alexi Nazem with us. So Alexi is a co-founder of Nomad Health and led the company as its CEO for 9 years. Nomad is the first online marketplace for freelance clinical work. He is also a clinical assistant professor of medicine at Cornell. And previously, he led national field operations for the Institute of Healthcare Improvement. Alexi, I'm so excited to have you here because we both went to Harvard for our MD MBAs, and it's really wonderful to see physician entrepreneurs. So thank you for being here.
Thank you, Liz. It's so nice to be back with you after too long.
That's right. I know that we've had various changes in our lives, going through everything from family planning to starting families. And I'd just like to start by saying, how have you seen your career in healthcare? And tell me a bit about some of your career moves and why you made them.
Sure. Well, I think much like you, I've had a kind of a winding career through a couple of different areas, intentionally winding. When you and I think we're sort of the same cohort, essentially. And when we were thinking about kind of breaching that barrier between medicine and business, it was kind of a taboo topic. And so you kind of had to be a little bit meandering and to an extent a little bit secretive, which I never like. Since the early 2000s, when I was in college, I vividly remember the announcement from the Human Genome Project that they had fully sequenced the first ever genome. And I thought to myself, this feels like the beginning of a whole new major era in humanity. And, whether business or technology or whatever, it just felt like a lot of things would change over the decades to come. In other words, over the decades of the rest of my life and my career. And I just want to be a part of that. And I figured at that time that it would be very important to have multiple, essentially, languages, to be able to speak the language of medicine and science, to speak the language of business. And so from a very early phase, I felt like it was necessary for me to be trained in parallel in those languages so that I was fluent, had native fluency in both. I didn't want to be a doctor who later got some business training. And I didn't want to be a business person who later sort of was an interloper in the world of medicine and science. Those are all very strong. Medicine is a very strong culture. Business has a very strong culture, and it's hard to sort of unwind some of that. You're just dyed in the wool about some of these things. So unless from a very early point you are actually thinking about that interface between those two things, I didn't think it would be very possible to be truly a successful person in this new era of medicine, science, and business. And so early on, I embarked on this dual track, and it forced me to meander. Years in medicine, years in business, years in medicine, years in business, and now I'm getting to do both at the same time because it's become a much more mainstream type of a thing.
Can you explain? So when you started Nomad Health, you were able to, of course, have the mindset of a physician, what it feels like, what you would want the experience to be when you get recruited and where locums. How did you integrate that in? And how did you also take the business mindset of scaling and growth and profitability and business initiatives?
Yeah.
I think it's so interesting because I think they are kind of two sides of your brain.
Yeah, absolutely. I think that was one of the things that was very appealing about this opportunity because it's not that Nomad's a household name or anything. So let me just say what it is briefly. We built a marketplace to improve the short-term staffing for healthcare. So it's kind of like Airbnb, but instead of houses and vacationers, it's hospitals and nurses or doctors or whoever need to be there for a short-term period. Hospital has a surge in patients during flu season. They need more ER nurses, for example. We built a marketplace online to make that happen more quickly, more effectively, higher quality, lower cost. And so being a physician who was often recruited for those kinds of roles, for locum tenens types of roles, I was a potential user. So that was actually
Yes.
it made it very easy for me to empathize with the user. And I could just say, like, this would work for me or this wouldn't work for me. And then I could, with a single text message or phone call, I could call, reach out to, a decent, sample set of other potential users. And that was actually very helpful in those early days of figuring out, okay, well, would this make any sense from a business perspective? And, it allowed us to, I think, do a little bit of product development in an advantaged way. Um,
Mm-hmm.
but from the very beginning, we needed to understand the business side of it, because as my dad, who is also in this entrepreneurial business himself, he says, bankruptcy court is full of people with great ideas. And so what you need is
Gosh.
to actually make sure that your great idea is also a great business.
Mm.
And so from very early on, we were thinking about, okay, well, how are we going to get paid? Why would someone want to pay us for this service? Why would someone choose us versus a competitor for this service?
So
And
speaking of
figuring
which,
those early on was very important as part of the
that
development piece.
you and I have talked a lot about that too. I want to dive a bit deeper into it because, like healthcare, I think sometimes people say, I experienced this. This was really hard to get this medication or whatnot. So people think of really good ideas, but they don't always think about how things get paid.
Yeah.
How would you coach people that wanted to start companies about thinking through that process?
Yeah. I think it is one of the most challenging parts about building a successful business in healthcare. First of all, healthcare is just super complicated about literally how the money flows. It's not like a normal business because it's usually a three-party transaction. There is someone who provides the care, someone who receives the care, and someone who pays for the care. So that
Mm,
alone makes things very complicated. But at the end of the day, you do need to. It feels almost uncouth, especially coming from a clinical background, to say like, well, how are you going to get paid? But honestly, you're not running charities. These things have to be
yes.
self-sustaining businesses. So how do you get paid from, you have to think about that from an early stage. And truly the thing that you have to do is figure out, are you creating value? Is it actually valuable? Because the only thing that people will pay for are things that are valuable. So
Mm,
things that are valuable either increase the quality, reduce the cost, improve the speed. It has to be something that leads to a meaningfully better outcome, and not incrementally better, meaningfully, significantly better. And so that's like a good first filter to kind of weed out some of those. Gosh, this is an inconvenience part of healthcare, which a lot of literally anyone who's ever gotten any kind of healthcare has experienced something that was inconvenient. Just because you experienced it and just because it was inconvenient doesn't mean that and maybe 100% of people experience it, doesn't mean that it's a big enough problem worth solving, unfortunately, if you want to make it a business. Thinking about how many people will pay for it, how will it get paid for, will it be paid enough to make a real business out of it? You gotta really think about those things early on. And
mm,
especially healthcare, which is, as I said, a very sticky payment type system. Sticky in the wrong way. It's
yes.
complicated, sticky.
So when you talk about this too, like when you were building your business, you were trying to get people to make it sticky and whatnot. What were those innovations that caused the company to be successful as you were building?
Yeah. So in our case, what we were trying to do is to disrupt an already existing industry. And I think that was a
Mm,
great way to um, sort of not have to solve a business problem, in the sense that we weren't trying to uh, build a entirely novel product and an entirely novel market.
mm,
We chose one of those things. We chose to follow the existing market, which was at the time a multi-billion-dollar market and has since grown substantially, and say, you know what, people are already willing to pay for this. We're just going to offer a new product, a new service that's just better. And by it being better and less expensive, so better service at a better price, that is a very winning combination. And people have already demonstrated their willingness to purchase these services. So we know the sales point. We know that they have budget for this. We know that they're already spending on it. We know that it matters to them. Can we
mhm,
now go to them and demonstrate a superior value proposition? And some of those innovations, like you're asking, are, for example, we introduced to this market transparency, which crazy that it didn't exist, but the fact that it wasn't the information about where these jobs were, how much you would get paid, what the service, what the shift
mhm,
structures were, all that kind of stuff. That was all, hidden information, and recruiters would try to kind of bait you in. And then after talking to them for half an hour and they get they sort of plumb you for all kinds of information, then they'll say, oh yeah, this job's in Buffalo and it's for, you get paid $50 an hour. And you realize, well, I called because I was interested in New York City, not New York State. And you're like, gosh, I
Oh,
wasted half an hour.
interesting.
So one of the big things was
Yeah.
just transparency, and then transparency enabled self-service, which also then therefore enabled substantially lower costs, because you don't need to have recruiters doing a lot of the upfront sourcing and recruiting and vetting and all that kind of stuff. So there's many daisy-chained innovations, but ultimately we wanted to create something that was just a better service, better experience.
Yes.
That's what we set out to do.
And did you leverage technology? Because there's all this work right now with like AI and automation. You must have been able to disrupt it in part with what you could bake in-house. Did you create it internally?
Yeah, technology is a huge part. It's actually the central part of our competitive advantage, is that we try to automate many of the processes that are necessary to go from sourcing someone to staffing on an assignment. Previous to Nomad's entry into the market, this was a completely people-powered industry. And we thought that if you could introduce technology either for automation or self-service, you would solve two problems. One is that you actually improve the user's experience, because it isn't a high friction, got to call 5 different agents to get, 5 different jobs, but rather come onto a single marketplace and see 1,000 jobs that I'm qualified for and be able to surf them all, filter them, whatever, in 2 minutes. That's a better user experience, but also it's a much better economic setup for our business and then ultimately for our customers, because we don't need an army of agents to do all that work. So you reduce the cost, which can then be shared back in the form of higher pay for the clinician, lower cost for the health system customer. So it's a real win-win. So technology was absolutely, and it's a classic technology disruption story, take something that was off and bring it online. The operating leverage gives you a better economic value proposition, and then, you win share.
Did you know that improving preventive care can significantly impact your health plan star ratings? Everly Health Solutions is the leader in at-home testing for health plans. Their convenient, member-centric approach has helped plans achieve industry-leading results. In just 1 year, Everly Health Solutions helped a multi-state Medicare group improve 15 of their plans by at least 1 star. That's a win for members, providers, and the plans themselves. Learn how Everly Health Solutions can elevate your health plan at everlyhealthsolutions.com.
Are there certain things that you think were really good lessons learned as an entrepreneur? We've talked about sometimes the hero's journey, right? Like where you're bottom of the pit and you're trying to get yourself out. And what were some of those lessons and that you think are really valuable that you'll take with you if you start another company, if you move into another role?
I mean, lessons abound. Like you said, from the outside, it always looks like a hero's journey. One quote that I heard from Steve Case, who was the famous CEO of AOL, he said that AOL was a 10-year overnight success. Like it really takes a lot of effort, a lot of, unfortunate running down blind alleys, only to find out you got to turn back around to actually get to where you're going. But that kind of trial and error is super important, and the failures are just as important as the successes. I learned a ton of things along the way. A couple are just, sort of product lessons. Some of them are just leadership lessons. So some of the product lessons were in those early days, you have to actually cast a very wide net to figure out who the right customer is for you. And so it's actually not the wrong thing to kind of spread, or at least I don't think so, to spread your effort across a number of different channels or customer segments or whatever, and just try to see where you get some traction. You're almost
where did you spread? Could you give me an example? Where did you spread yourself? Just to give an example, is it multiple hospital systems?
Yeah, so we didn't know what is the right thing to do, a regional strategy or a national strategy. Is the right thing to focus on in-person, staffing or telemedicine staffing? Should we focus on this specialty or that specialty? And so we kind of tried all different versions of all of these things, expecting that many of them would not work, and just be willing to fail fast, so that you say, okay, this. So a perfect example is telehealth.
Mm,
it was one of these sort of like sugar high type things, super high uptake. Everybody, all of the telehealth companies and all of the clinicians on our marketplace were interested in it, but it wasn't a good business. The margins were low. The total addressable market was kind of small when you think about it. And so, or at least at the time, this was like 2017. So it was like, pre-explosion from COVID. And even now, I would still say it might be a tricky business from a staffing perspective. But learning that and seeing like, oh, great. So it was really easy to sell it. But then you kind of reach the end of the opportunity pretty quickly. That was very helpful for us to know and to say sometimes things are just shiny objects, but there's no substance. And so that was helpful. And then actually an even bigger version of this was we started the business in locum tenens staffing, which is staffing
mm,
doctors short-term periods. And we ended up exiting that business. And we had that business stood up, then we opened up other marketplaces for nurses and allied health professionals. And eventually we just shut down the doctor's business because we learned a bunch of lessons that was not as valuable of a market
mm-hmm.
segment for a technology driven marketplace, at least not at the time. Less standardized. There's no clear sales point. There's no way to aggregate the demand. So there was or without a tremendous amount of effort. And so you learn those lessons, and gosh, you have to be willing to kill your babies. It's a terrible, term from copywriting, but like
Mm,
it's hard to edit, but you have to say, gosh, I thought this
yes.
was a great idea. We started this company on this idea, and then we shut down that business. And we learned a ton from all the mistakes we made there, and that allowed us to be successful with nurses and allied health professionals in a way that we weren't with doctors.
That's so great. I get this question all the time from allied health professionals and nurses. How do you do side gigs, and how do you sit on boards or learn to be an advisor or become a chief medical officer of a startup? So I feel like it's a really interesting space. I bet you tapped into it really well because there are always people looking
Yeah,
and wanting to improve and wanting to learn and wanting to gain new skill sets. I also wanted to ask you about
gosh,
your advice for not only aspiring entrepreneurs, but how you think about the world as we sort of close off this session. It's like, how are you thinking about your next stage, next phase? What kind of drives you? And also on top of that, I'm impressed that
sure.
you stayed for 9 years because that's a really amazing, dedicated, long time.
Yeah. Well, first of all, it's very easy to stay hard at work at something when you really, really love it.
Mm,
And what constitutes love, right? You have, first of all, a very meaty problem. There's a
mm,
lot of aspects to it. There's a lot that you can keep unpacking for a long time. It's a problem worth solving, going back to an earlier part of our conversation. Um, if it is really meaningful and impactful to solve the problem, it's
yes.
easy to spend 9 years or 10 years or 20 years on it, right? And then the second piece is about building a great team. I went to work not only to solve the problem, but also to work with the people. It was really exciting to work with
Mm,
some of these brilliant people. It's actually one of the greatest privileges of starting a company is that
it's
you have a
true.
reason to hire and bring into your orbit some of the smartest, most interesting, capable people in the world. And you're
Hmm.
like, kind of like paying them to be your friends, It's like, it's pretty cool. And you learn so much. And so I really, really like that a lot. And then just, as in being in the founder seat, it's really fun. The CEO seat, you get to wear a lot of hats every day. So for someone who's got a peripatetic mind like me, it was really exciting that
Mm,
my day started with like a product meeting. Then there was a marketing meeting. Then there was a legal thing. And then there was a, sales call that I did externally. And just like being able to kind of get all that stimulation, even 9 years in, is just super exciting. Even in the hard times, that's a new experience too. You learn something new about like, oh gosh, this, unpleasant thing. Well, I got to learn how to do it. And so easy to stick with
amazing.
it in that
Hmm,
regard. But anyway, and in terms of what's next, gosh, I don't know, but there are so many exciting
hmm.
things to solve in healthcare and just in the world in general. It's new technologies,
Yes.
both in science and in computer science and all that. So like the opportunities abound, and the hard thing will be picking what to do. And we'll follow hopefully some of those principles as I was saying before. Is it a problem with solving, and are there good people solving it?
Well, I feel like knowing your background and how driven you are, hopefully you'll be able to take the time off. But I'm also really excited to see what we're going to do next.
Well, too.
Um, yeah, it's going to be it's a great time to be innovative in healthcare right now. So Alexi, it's
Well,
been an absolute pleasure. Thank you for being here. And before we wrap up, we always ask people for their hot take on 5 key questions.
okay.
So the first question is, what's the best advice you can give anyone? Could be 1 or 2.
Love what you do, whatever it is that you do, whether it's work or life. Give your whole heart, because if you're going to spend time on something, it better be worth it. Time is the most precious resource that we all have. And so, spend it wisely.
I love that. What about your favorite business quote?
I am going to actually pull a quote that my dad always used to say to me. He would quote George Bernard Shaw, the famous Irish playwright. He used to say, there are those who look at the world and see things as they are and ask why. And I dream of things that never were and ask why not. I always loved that because I don't know, I love creating things, and it's just kind of fun to push the boundaries and be that kind of unreasonable optimist. So that always spoke to me very much.
That's so great. How about the hardest challenge and how did you overcome it?
There've been so many hard challenges. If I restrict it just to this time in Nomad, the last couple of years have been very challenging because of the broader market environment, both in our specific market and then more generally in the capital markets for companies like ours, which are sort of venture-backed growth companies. And so we had to do a lot of hard things, including unfortunately having to lay off a meaningful portion of our staff. And the hardest part about that was none of those people did it wasn't their fault, it wasn't anyone's fault. It just happened. And I couldn't even tell them why and when it would turn around. And so same thing, it was sort of similar thing in the pandemic. It was an extraordinarily negative shock to the system, both personally for everyone and then of course for us as a business. And again, didn't know a lot about what was going to happen. So a big leadership lesson that I learned out of all of that was to be as much as possible a truth teller, really be transparent with people and invite them into the problem and just say, this is what I know, this is what I don't know, this is why we're doing what we did. I'm the fallible human like you, but these are what I think are the best possible decisions. And I think that earns a degree of trust. But gosh, those kind of times are really hard. But I think, truth and collaboration really help you get through them.
I really appreciate that. I think we, as leaders, have a responsibility to be kind, but also firm in some of these decisions that aren't always easy to make, but you have to make it both for the company and for, oftentimes, like you said, there's no exact reason for why one person, sometimes these layoffs and reductions in force are just based off of numbers and needing to hit certain goals. So and especially with macroeconomic factors, you just sometimes can't control or foresee.
Yeah.
So thank you for sharing that. Another question is, what's most exciting for you about healthcare innovation right now?
Do we have another hour? that's like, there's so much exciting stuff. I think medicine is a real inflection point. The thing that's very exciting for me is that we are now in the first time in probably over 100 years on the precipice of really having a legitimate opportunity to change the way that we practice medicine, deliver care, because of the availability of not only new biotechnologies, but also care delivery technologies. So whether it's all of these exciting advancements that we're now harvesting after 20, 30 years of very cutting edge biotechnology advances like CRISPR and, CAR T.
Yes.
It's like the amount of things that we can possibly do, just like from a truly life-altering, substance-altering perspective, it's very exciting. And also, given that how there's this flourishing of actual like scientific technology, the information asymmetry and distribution problem is really big. And so there's an opportunity to not just rely on, hey, I learned all this stuff in medical school or nursing school, whatever, and leverage things like, whether it's large language models and AI or workflow automation, or to the finally leveraging all of this last 20 years of infrastructure investment and technology infrastructure investment in healthcare. All of these things are converging all at the right moment. I think we're at sort of like a Cambrian explosion type moment where medicine 20 years from now is going to be almost unrecognizable from medicine, 20 years ago.
Absolutely.
that's what's exciting, is just the opportunity for change right now.
I love it. If you could have any superpower, what would it be?
Well, calling back to what I said about time being the most precious resource,
Boom.
pausing time, dilating time. If I could have more of it, I would love that superpower.
That's
Cherish every
great.
moment. You know. Anyway, time is the only thing that all of us have the same amount of, and gosh, I wish I could stop it.
It's true. It's true. There are moments where I want to freeze time, both with the kids, but also in certain friendships and interactions. I'm like, oh, this is so perfect. So, Alexi, it's been an absolute pleasure discussing the healthcare landscape with you, and your insights on the integration of healthcare and startups has been really enlightening. So, thank you for sharing all your knowledge about Nomad and the impactful work that you're doing. So, for listeners, for more on Alexi's work, you can follow him on LinkedIn. We will link it in the show notes, and we hope today's conversation has sparked your curiosity and inspired you to explore further. So thank you for joining us. And until next time, keep on innovating.
Thank you, Liz.
Did you know that improving preventive care can significantly impact your health plan star ratings? Everly Health Solutions is the leader in at-home testing for health plans. Their convenient, member-centric approach has helped plans achieve industry-leading results. In just 1 year, Everly Health Solutions helped a multi-state Medicare group improve 15 of their plans by at least 1 star. That's a win for members, providers, and the plans themselves. Learn how Everly Health Solutions can elevate your health plan at everlyhealthsolutions.com.